Welcome everyone, this is Dr. Mercola, and today we're privileged to have with us Charlie Brown in person, live from Washington, D.C. He's here as a result of attending the American Health Freedom Expo. And he, for those of you who haven't seen Charlie before, he is the director of the Consumers for Dental Choice. But prior to that experience, he's an attorney and was the Attorney General actually for West Virginia, and is really a passion for providing for justice. I mean, I don't really have a fond view of many attorneys, but Charlie's one of my favorites. You know, because we have too many legal issues in the U.S., but we certainly need some good guys. And Charlie has a major white hat in my perspective, and he's doing massive, great work for really addressing one of the most potent toxins in our environment, which is mercury, primarily in at least one of our largest exposures for most people is through the dental amalgam fillings they have. And it's just an absolutely unnecessary element. And Charlie's been catalyzing the actions to remove it from the environment and as a choice for dentists to use in this. Because I'm a big proponent of free choice, but there's just no reason one of those choices would be a potent neurotoxin that you put in your mouth for decades. So welcome, and thank you for joining us.
Thank you, Joe. Great to be right here with you in your studios.
All right, well, thanks. Now, what is the most shocking evidence that you can provide us about the unfair policies and practices that are present today with respect to mercury fillings?
From the consumer viewpoint, amalgam would be gone if consumers only knew that it was mercury, that it was mainly mercury. A Zogby poll said that 77% of consumers, if they knew amalgam was mercury, would pay more to get something else. This was before they were told about the impact of the mercury,
It's
just to learn it.
Kind of like GMO in some ways.
Absolutely.
Because most people would, about the same percentages, would refuse having GMO in their food if they knew. But the industry is very clever. They've learned their lessons, and they've been effectively been able to use political influence and muscle. And you're based in Washington, D.C. You're right there on Capitol Hill, and
Yes.
you're very familiar with this lobbying effort. So they've been effectively able to eliminate that as a choice, very similar to what they're doing with
Yes,
this
by
issue.
getting the government to say, don't tell anybody anything.
Mm-hmm.
And on the state level, the dental boards have told dentists, don't tell them anything, or we will threaten your license. Well, that was the first thing we did in this movement, was to establish the right of dentists to speak, to tell the truth, to talk about mercury, under their rights under the First Amendment of the United States Constitution. So the word is getting out, but the word is not out all the way by any means because of the silver fillings deception and the gag rule. But it's shocking that 3/4 of the people would, just knowing it's mercury, would not take it. The other shocking development is more recent, and that is that in December, at the Food and Drug Administration convened a hearing of scientists that it handpicked. Now, we all know lawyers can be bought and sold, but Joe, as you pointed out, and I point out frequently, so can scientists, so can economists, so many fields, because where the money's coming from tends to get the result. But FDA's own hand-picked scientists told FDA, you've got to stop amalgam use for children, for pregnant women, and for hypersensitive people right away. And you've got to make sure every patient knows that it's mercury.
It's particularly extraordinary because most of these people, you would think, would have some industry conflict of interest. That's the typical pattern that we see in these committees. So even though there may have been or may not have been, but the possibility exists, and they still came up with this decision.
Well, the chairwoman was quite conflicted, and she kept trying to stop this from happening. She's a consultant for one of the dental insurance companies. But the rest of the panel, even panelists that had been on record the other way, once they got in the room and spoke for themselves, they said, let's stop amalgam now for the most vulnerable. So here the clock keeps ticking, and FDA now won't even do what its own scientists have told them to do.
And what do you believe that the reasons for that are?
Well, FDA cannot admit it ever made a mistake. The FDA feels it's got the infallibility of the Pope.
Like most
of us. Absolutely. Absolutely.
It's very difficult for an individual to make that correction, but for an institution it's close to impossible.
Well, that's why we've hammered on FDA for 9 years now. But remember, we can run FDA, Joe. We can lose every battle at FDA and end amalgam. The environmental route is by far the more promising. So is the consumer choice route. People just ignore it. People obviously, anyone who reads your newsletter knows they should not get amalgam. We change insurance, we change consumer choice, and the environmental regulators enter. The most promising environmental development is, of course, the pending World Treaty on Mercury, which we hope and we're fighting like crazy to have amalgam included.
Yeah, maybe if you can just do you perceive this route as the most promising to end the use of mercury in dentistry is from this taking the angle from the environmental perspective? Because
Yes,
as you mentioned,
it is the most promising.
our approach is to educate the consumers and really have a groundswell up to vote with your pocketbooks and not choose this. But many people aren't able to do that, or they don't have access to, or aren't aware of this, or they choose not to because they're biased by the information they're receiving from their dentist, who they believe. And is probably confused on this issue because they haven't studied it carefully and they believe the American Dental Association. So, but do you think the environmental route's the way to go?
Yes, it is. And I think the American Dental Association ultimately is going to have to throw in the towel. They're going to ultimately realize it's either their profession and their dues money or amalgam. And when forced to choose, they're going to cut something loose, and they will cut loose amalgam. They're not ready to yet. But when the environmental regulators are on their back, the consumer choice is getting amazing, and now they're going to these world treaty negotiations and being hammered by African delegates, Arab delegates, Asian delegates, Latin American delegates who are saying, we don't want the mercury here. Don't think because you can't sell your amalgam in Europe and North America that you're going to start selling it here. We don't want it.
You know, one of the arguments that was previously used to justify the American Dental Association's position and reluctance to change their policy on it was that if they did that, there was an implied liability that could result in trillions of dollars of lawsuits, class action lawsuits, because of this. And do you think that, I mean, as an attorney, I definitely would appreciate your view if this is was that realistic a concern? And if it is, if it's approached from this other angle, where there's an environmental perspective, would that remove this liability from the American Dental Association?
It removes the liability. The American Dental Association sits about 10 miles from where we're sitting, and 5 years ago I went down to their offices and met with their lawyers, and I said, I want the soonest end to amalgam. If it costs you billions of dollars and shuts you down, fine. If it doesn't cost you a penny, fine. Here's how it won't cost you a penny. You, the ADA, declare yourselves good stewards of the environment and say it's time to end the use of amalgam. And the lawyers wanted to do it.
So what happened?
Leadership,
So
leadership didn't want to do it. The profits are too good. The profits are so good for dentists to drill, fill, and bill in inner city Chicago, in the Army, in the prisons, in all the institutional places, in the Indian Health Service. All they have to do is just fill teeth, drill, fill, and bill, and they end their day.
Well, help me understand this, because that doesn't make sense to me, and I'll tell you why it doesn't. Because one of the benefits, supposed benefits, of amalgam fillings is it's so damn cheap, you know, relative to the other dental materials that are available to dentists. So if they have this drill, fill, and bill approach or policy, that if they substituted a more expensive dental material, wouldn't they generate more profits?
No, they make more per chair per day with the mercury filling.
And why is it? Help me understand.
They do it so fast.
Oh,
they just do it so fast.
Because it's
the patient is not a person to them. To the mercury dentist,
sure.
It's money. It's how many teeth. So that's how they can
so
do
you can,
faster.
So that's, as a as not a dentist, I wouldn't understand, and I'm sure most of our viewers wouldn't realize that, but technically, you can insert a mercury filling much quicker than a composite filling.
Quicker enough, yes, yes, you can.
So you can get the speed, because obviously a dentist really is reimbursed for his ability to do procedures, so he can do more of them per unit time than he can a composite.
Well, and here's a reason that the American Dental Association, another reason they like it, is it destroys good tooth matter much more than other fillings. You carve out good tooth matter, so that tooth is going to be a problem later. So
when,
it will be the gift that if you do a mercury filling, the tooth will be more damaged. So mercury fillings is the gift that keeps on giving for the dentist. 10 years later,
okay, so it's an investment for the future.
Absolutely. They're damaging something that they can keep working on their whole life.
But with respect to being more efficient and doing higher volumes, if they're actually removing more material, wouldn't that take more time? than a composite for that aspect? Or I guess
Just the composite, you shape it, you have to have
okay.
it
All right.
dry.
So there's a lot of technical
yeah,
components.
technical things. But I'll
Okay.
tell you what's coming. But the composite really does not cost more than the amalgam, though, either. That's the other for a small
the actual
cavity.
material.
For a small, no, for the work.
For the
cost-
labor,
co-
the
for
labor.
The labor and cost for a small cavity, the composite is the same price.
Okay.
So they have a myth that it's more. But what's a lot less price is a new system, not new, but it's new. This country hasn't been talking about it. Atraumatic restorative technique, ART. It is the solution in the developing world for children with small cavities. You don't need any drills.
Wow.
You just need tools.
And how do you
need
do that? I've never heard of it before.
It's just material they put on the tooth. They use their tools. They need a battery. That's the only technology that could wear out is the battery on the flashlight.
Solar
You go into the
powered.
bush. You go into the villages. It costs a third to a half as much, according to the Pan American Health League.
How do they remove the diseased tissue or decayed
You carve it out with the tools. That is, it's
okay.
only for small cavities.
Okay.
For big ones, you go to a dentist. A non-dentist can do it. The hygienist can
Wow.
do it. And that's what has the dentist panicked.
Hmm.
They lose their monopoly. The price is low. It doesn't need a clinical setting. You can go village to village in Africa and India and so on.
Are
where
they
there's
actually
no
doing
dentist.
this now?
They are doing it. The World Health Organization repeatedly said it works. But I think it scares a dentist because of the monopoly, and I think there's dentists that think you got to have expensive tools to look like a dentist. You got to have that big drill. It just makes you look more powerful than these little tools.
You know, what they fail to realize is that they will always need experts
Yes.
to guide us, and the professionals who really understand this and can see the more difficult cases. And there's this fear, and certainly it's even in natural medicine too, that people feel that if they teach people everything they know, then they're not going to come and see them. When that's the exact opposite occurs. I found that in my own website when I put everything I knew how to take care of patients. Every single thing I did, left not one thing out. They gave it all away for free, and yet people would still come to see me because they just had to hear it from me or something, and they didn't have that professional guidance and counseling to nurture them through them. So this fear they have is really unjustified.
Sure, dentists will make plenty of money doing the more complicated work.
Right.
The small cavities can be done by the trained non-dentist professional, and the dental assistant, dental hygienist, and the dental nurses, they're called in some countries, and the dentist
And
will
they
go
may even
ahead
make,
and do
may
well.
even, the paradox is they may even make more.
Sure you will.
Or
It's
not paradox, but the
complicated
irony,
work.
yeah.
I'm a lawyer. I made big bucks on complicated stuff. I
Yeah.
didn't make money
this-
writing a contract. Come on.
Yeah. They can do that with some nice software programs now
Yeah,
for
yeah.
really cheaply.
Uh-huh.